and welcome to Chapter 6. So this week we're going to be learning about defenses to liability suits. How can we prevent liability suits? Prevention is of course preferable to actually going through the process of a malpractice suit. Obviously we don't want to get to that point, we want to try to prevent that before it even happens. Healthcare practitioners who use reasonable care in preventing professional liability claims are least likely to be faced with defending themselves against such liability claims. 4 C's of medical malpractice prevention. Number 1 is caring. We should be showing our patients that we care. We should also avoid destructive and unethical criticism of the work of other physicians or healthcare practitioners like dentists. Number 2, communication. We should be communicating clearly and ask for confirmation that you have been understood. So especially when you're like giving post-care instructions, be like, do you have any questions about what I just covered with you? Do you understand what I just covered with you? Just asking for that confirmation will help prevent any miscommunications. Number 3, competence. We should know our professional area well, including our limitations. We should also constantly be updating our knowledge and skills through CE, through different educational avenues. And number 4, charting. Documentation is really the only form of proof we have at the end of the day that something was or was not done. So for legal purposes, if it isn't in writing, it wasn't done. So make sure that your notes are thorough, including every procedure, every material that you used, any questions the patient may have had, things like that. So the Joint Commission has released some patient safety standards that they feel like healthcare professionals should follow. A lot of these are meant for like a hospital setting, but still we can use them in the dental setting for a good majority. So number 1, make sure we're identifying patients correctly. 2, give correct blood to patients receiving transfusions. Number 3, get test results to right staff person 1 time. Number 4, label all medicines in all containers before a procedure. Number 5, identify medications patient is taking and compare them to the new medicines. Number 6, check alarms on medical equipment. Number 7, use the CDC or WHO guidelines for hand cleaning. Use proven guidelines to prevent infections, blood infections from central lines, and infections after surgery. Number 9, identify patients at an increased risk of suicide. Number 10, perform correct surgery on correct patient on the correct place on the patient's body. And then you can also find additional guidelines for patient safety through the Joint Commission. So those are just kind of like some standards that all healthcare professionals should be following to help reduce any liability suits against them. Obviously there's more ways, but these are a really good starting point at least. So why do patients sue? It could be because of an incorrect, ineffective diagnosis or treatment. So either the diagnosis was completely wrong and then they suffered consequences from it, or the treatment that was given to them just was ineffective and maybe even made things worse. Next, the patient suffered abnormal injury during treatment or surgery. So if something went wrong during the surgery or treatment process and they suffered some kind of damages from it. The patient was given wrong medication or dosage, something that could have been prevented. The patient was not given correct aftercare instructions, so then they went home, followed the instructions that were given to them, and it caused them more damages than if the correct instructions were given. And then patient did not give informed consent, so something was done to them without them consenting to it. So communication with patients, so important. First, we should be developing good listening skills. A lot of communication revolves around the listening aspect of it. So by listening clearly to what the patient is saying and actively like processing the information instead of just thinking about what you're about to say next, that'll help contribute to good communication. We should also be setting time aside each day to call patients back if needed, provide advice. A lot of dentists do this after surgical procedures, extractions or implant procedures. They will call the patient, check in, see how they were doing, making sure everything's okay in the recovery. Thoroughly explain illnesses and treatment options. So just explaining things, patients, a lot of the times they don't know the dental lingo, they may not be aware of different illnesses or treatment options, so we need to thoroughly explain them to make sure it's clear to the patient what's happening and what the process is like. Make sure informed consent forms are signed, so that's super important, especially during surgeries, extractions, things like that, root canals. We need to have signed consent forms that just prove that the patient said that it was okay for us to perform this procedure. Avoid statements admitting fault. Use tact, good judgment, and professionalism with patients. Refrain from overly optimistic statements, especially during something that could turn very bad. So say that you're taking an x-ray for a patient and they're like, oh, do you think this tooth's savable? And you're like, oh yeah, for sure it's savable. And then the doctor comes in and it's like, you need this tooth removed like ASAP. That's really gonna upset the patient if they had this optimistic viewpoint from you, and then it's a complete 180 and it actually needs extracted. Just not good. So it's better in those situations to just keep quiet and not say anything and say the doctor will be in just a minute after he reviews this x-ray. Advise patients when physicians will be gone for long periods of time. So if your dentist is on vacation or is just out for some reason, is sick or something, we need to let our patients know, especially if it's known in advance. That way they can schedule different appointments around those times. And then we also need to communicate with patients about fees. Documentation. So again, we said this earlier, if it isn't in the patient's record, it was not done. Documentation is so important. Medical records should clearly show what treatment was done and when it was done. Lots of information needed. From a legal standpoint, it is important that documentation shows that nothing was neglected in the patient's care and all standards were fully met. So types of defenses when you're in a liability suit. 1, denial of wrongdoing. 2, affirmative defenses, which can be contributory negligence, assumption of risk, or emergency. And then there's also technical defenses such as release of tortfeasor, res judicata, and statute of limitations. We're going to get into these a lot more in depth in the upcoming slides. So denial of wrongdoing is first. It is the assertion of innocence or that the charges do not meet all of the elements of the 4 Ds of negligence. So the 4 Ds of negligence: 1, duty of care; 2, deviation of duty, so that you kind of went outside of your scope of your normal practices. 3, damages. It caused some kind of damage to the patient. They suffered some kind of consequence from it. And then 4, direct causation, so that they can link that damage directly to you as a provider. Then next we have affirmative defenses. So this allows the accused to present factual evidence that the patient's condition was caused by some other factor than negligence. So number 1, contributory negligence. The plaintiff caused or contributed to their own injury, that it wasn't necessarily just the physician or provider's fault. And then there's also comparative negligence. So the plaintiff contributed to the injury by a certain degree, such as the patient contributed 20% and the physician contributed 80% of whatever negligence or damages that the patient believes that they caused. This could be something as simple as like following post-care instructions, that maybe the office gave them a set of instructions and the patient just didn't follow it. Then that patient kind of contributed to the damages that they received. Next, assumption of risk. So the patient knew of the inherent risks before treatment was performed and agreed to those risks. This is when informed consent becomes super important. So a lot of times on the informed consent form, all of these inherent risks that could possibly happen are on that consent form, so the patient should know ahead of time. We should also be verbally going over these risks when we're having the patient sign the form as well. So they should be kind of reading it and hearing it from us as well. So kind of like when you see medications on the TV and the ads and they're like, oh, this could cause heart defects and diarrhea and all these other things. You know the risk before you take that medication. So this is kind of similar. The patient should have known the risk when they signed that consent form before the surgery or whatever procedure took place. And then the last affirmative defense is emergency. So a true emergency existed and was not caused by the defendant. So say they were performing a surgery and the patient suddenly had a heart attack while on the table. That's not necessarily caused by the physician. That's just something that happened during the surgery, unfortunately. So that's kind of where that emergency falls into place. And then also the doctor who is doing the surgery in that instance, as long as they are performing steps to help the patient while they're having a heart attack, that's that last line. The appropriate standard of care provided still has to be there. You can't just, the patient's having a heart attack and you walk away and we're like, well, nothing we can do. You still have to help them. But in that case, you could claim that it was an emergency and you couldn't have helped the damages that the patient suffered because you didn't do them. It's just something that happened as an emergency. Next we have technical. So first, release of tortfeasor. This prohibits a lawsuit against the person who caused an injury if he or she was expressly released from further liability in the settlement of a suit. So if a suit gets settled, the person who filed the lawsuit, the patient who said they got damages, they cannot be further liable down the road. So if the patient has continued issues from it down the road, they can't be sued again. Next we have res judicata, which in Latin is the thing has been decided. It is a legal principle that a claim cannot be retried between the same parties if it has already been legally resolved, so they can't sue them again. And then last, statute of limitations. This is a period of time established by the state law during which a lawsuit may be filed. It varies by state, so a lot of the times patients only have maybe so many years, maybe 3, 4, 7 years that they can file a lawsuit, and then after that period of time, once it's passed, they can no longer file a lawsuit because it's past that statute of limitations. Next we have risk management. So risk management is the taking of steps to minimize danger, hazard, and liability. We should all be doing risk management every day, no matter if we're at a dental office, a hospital, wherever. We want to be taking steps to help prevent any areas of concern for patients. This could reduce the possibility of lawsuits, identify problem practices or behaviors in the office, and then also helps you eliminate these problems as well. Next we have QI, quality improvement, and QA, quality assurance. These are programs that uphold the quality of patient care and help reduce liability risks. They are part of the methods used to manage risk and include compliance with federal, state, and local laws. So this is how we devise a plan for quality improvement when looking through our processes that we normally do. Number one, we need to first identify areas where improvement is needed. We need to look at our processes saying this could be a little bit better and then change them slightly. Next, we need to determine which data we should be collecting to find out if improvement has been achieved. So we make those changes to our processes and then we need to assess those changes in some way. Did it make things better? Did it keep things the same? Or did it make it worse? Next, we need to decide which changes will create the most improvement with the least amount of effort. Then we want to implement the action and then evaluate the results. Was there actually improvement? Professional liability insurance. This covers the cost of defending a medical malpractice lawsuit up to the policy's limit. The cost of insurance is based on the physician's specialty and dollar amount of the policy. So essentially the physician, the doctor, the provider gets this professional liability insurance, and if they do end up being sued, this will just help kind of put the insurance towards those costs that the dentist or physician is incurring. It's usually required to obtain hospital privileges or to work with an HMO. So sometimes the dentist will be affected if they work at a hospital, but a lot of the times just being in a private office, it may not be a required thing. Medical malpractice insurance types. So there are claims-made insurances, which covers the insurer only for claims made, not for injuries occurring while the policy is in force. Then we have occurrence insurance or claims incurred insurance. This covers the insurer for any claims made that occurred while the policy is in force, regardless of when the claim is made. And then we have extended coverage insurance. So this could be tail coverage, which is when a claims made policy is discontinued. Tail coverage extends coverage for malpractice claims alleged to have occurred during the time when the policy was still active. So you get rid of that insurance policy, and then 2 months later a patient sues you for something that occurred 2 months prior when you were still covered. That tail coverage will still kind of help cover those costs because it occurred at a time when you did have insurance. Prior acts insurance coverage, it's a supplement to a claims-made insurance policy that can be purchased from a new carrier when healthcare practitioners change carriers. So it's kind of like a supplemental thing they can add on. And then there's also the self-insurance coverage, where they are contributing to a trust fund that can be used towards potential damage awards.